Buenos dias, good morning, bon dia to everybody after this long weekend, the Memorial Day weekend. We're hoping that this is a week in which we're going to start seeing a little bit more of light for our Hispanic community. There's been a number of things. This is part of the Hispanic Response and Recovery Plan, a framework to mitigate the impact that COVID has had in our community, particularly small businesses, entrepreneurs, and independent workers. It is the point of this gathering to bring the state of art in different areas, from health to economics, business practices, policy, and other industries. In this occasion, we're going to take a deeper look at media with Christy from CBS. It is our intention also to make sure that everybody understands how disproportionately affected the Hispanic community is, and how important it is to make sure that we make that point so that we can disproportionately bring solutions to the Hispanic community that has been affected at the health level, economic level, but also how much we're disproportionately exposed when we have so many of our community in the front line running the country. It is my pleasure to kick off these Tuesday weekly updates that we've been bringing for 7 weeks, more or less, right now. And so to kick off us always is Dr. David Nabarro from the World Health Organization, WHO, who's a special advisor for Dr. Tedros on COVID-19. Dr. David Nabarro.
This is David Nabarro speaking to you and greeting you as the broadcast for the Hispanic Star gets underway. And I wanted just to talk about the way in which the COVID pandemic is progressing across the world. Right now, we see the challenges in Latin America are particularly great, with very large numbers of people with COVID being reported from Brazil, but also from other countries in Latin America. It's affecting people particularly who are older, but it's also pronounced in areas that are poor, and particularly where people live very closely together. And when there's a lot of COVID in a community, health services get badly affected. You're all playing such an important role in the response to COVID. You're trying to fight COVID and reduce the threats in your workplaces. You're trying to reduce the threat of COVID where you live. And you're also doing everything you possibly can to protect people who are at risk of the disease. And this is particularly older people, or people with diabetes or high blood pressure or other similar conditions. I think what COVID is doing is it's showing us just what a lot needs to be got right in our world. It is particularly poorer people and weaker people who are most likely to die as a result of the disease. But it's the actions of all of us that will determine whether or not they're able to be healthy and avoid suffering. So I want to stress to you that now more than ever, we've got to do all we can to reduce the spread of this disease. That means physical distancing, trying to keep 2 meters apart from everybody wherever it's possible, unless we know them well, for example, people in our families. Trying to protect those who might be infected by us if we have early COVID, by making certain that we isolate ourselves quickly when we have the disease. And also making certain that even if we are not sure whether we've got the disease, if we're out and about in the community and we have to be close to other people, we wear a face protection of some kind and do everything possible to fit it tightly to our faces so it reduces the risk that others are infected. We've got to be able to protect people who might be at particular risk. And that means doing everything possible to make sure that we don't accidentally expose them to infection. And we do need all the time to look after our health workers. I expect many of you are working in healthcare. We need to make sure that all health workers are kept as safe as possible, because there are people with COVID who are coming to hospital. They may not know they've got COVID. And so health workers must do what they can to avoid infection. And that means having the necessary protective equipment. Let's make sure that if a COVID outbreak develops in any community, it's closed down quickly. And that means restricting movement in the local area to ensure that wherever the people might have disease, we can find them and help them to be isolated, and find those with whom they've been in contact and enable them to be isolated too. Some people say that governments are having to make choices between looking after people's health and caring for the economy and making sure everybody's got jobs. It's not a case of an either or choice. You've got to get the public health part right, enabling communities everywhere to protect themselves against the disease. And then that means the economy can be working properly and well. And also there's a false choice between keeping ourselves under surveillance and having liberty. Being under some degree of surveillance to check whether or not we've got ill health, that's an important part of ensuring that liberty is available. And then some say that we're putting too much emphasis on individual responsibility. We should be focusing on solidarity. I say that individual responsibility is key, because what we does determines whether or not others are at risk of infection. But it's through that individual responsibility that solidarity across communities and within societies become possible. The only way that our societies can be ready for COVID is through working together with responsibility, with solidarity. And I thank all of you for what you're doing. I'd like to keep coming into your meetings at regular intervals and making a few remarks. I'd like to be sure that you get all the support you need to enable you to be playing your part in the fight to reduce the threats caused by COVID. Don't hesitate to be in touch with us through the people who are organizing these videos. We'll do what we can to try to support you in any future broadcasts. Thank you very much indeed for the chance to be with you today. Stay well, stay safe, stay strong. You, together with others in our human family, will help us all to keep COVID at bay and to reduce the risk to ourselves and to those we love. Thank you again.
Dr. David Nabarro. He's talking about like rules of engagement, and the reopening of the economy and the world seems imminent in his remarks. Gillian, Tett. Gillian, thank you so much for being with us again. Gillian is the chair of the editorial board and editor at large of the Financial Times. Gillian, you've been with us from the very beginning, and thank you so much for being with us when you can. You've been talking about the shape of the economy, whether it's a V, a U, an L. I've been hearing a lot lately that it's going to be an L, and that people need to reopen sooner rather than later before this gets deeper and like as a deeper collapse in a way of the economy. Gillian, what's the update that you have? And I also have a question regarding not only an update, but also a recommendation. I know that a number of the Hispanic community, small businesses, are keen to reopen their own businesses, be restaurants, be hotels, or service economy. I think that there's a huge desire for them to restart their businesses, but I think that the consumers have to come along with the policy and you know, like and the authorities along. Is there anything that you have seen in business practices that could be applied for small businesses of Hispanics, maybe a seal of saying like, yeah, all my employees have been tested COVID negative, or temperature changes are checks and so on? So first is the update, and the other one is a recommendation for a small business.
Well, thank you, Claudia. It's great to be on your show again, and hello to everyone who's watching. Great to be talking to you. Okay, let me start with the good news. The good news is that what you're starting to see in some parts of the world, like Europe right now, is a sign of a movement towards, if not normality, then some very tentative opening up and some very tentative signs of economic activity resuming. The recent data, certainly from Europe, has been quite encouraging. So that's the good news. The other bit of good news is that, as you've just heard or just said, Claudia, you are seeing businesses across the country, not just in the Hispanic community, but I'm sure in the Hispanic community, who are keen to get going. And in fact, over the Memorial Day weekend, we saw signs that parts of the country are indeed starting to get going. The most visible were some of the parties that were seen down in the Ozarks, but other parts of the country are certainly trying to restart economic activity. The bad news is that it's not clear, as you say, that consumers will come flooding back even when businesses do start. we have a very instructive example from Georgia, which essentially tried to reopen or said it was going to reopen a couple of weeks ago. And although it has technically reopened, consumer activity has not bounced back dramatically, and nor have other business indicators of actual activity. So what does this mean? Well, it means that I suspect testing, and PPE are going to be the absolutely critical components to restarting economies and, above all else, rebuilding consumer confidence. Anybody who is wanting to see how to do it should actually widen their lens right now beyond America and look to some other countries, because places like New Zealand, Thailand, South Korea show a dramatic alternative to what we've experienced here in America, because they really have managed to contain the problem through excessive testing, discipline, PPE, measures like that. And we can't turn America into Singapore or Taiwan or South Korea or New Zealand overnight, but businesses should be looking really carefully and reading up on what's happened on the ground in those countries and thinking about how they can apply those models to their own experience in terms of trying to build consumer confidence. You know, at the very least, they should be looking at the lessons from wearing masks and using other forms of PPE and testing where possible, and just thinking about it, because there are some very smart ideas out there on the world stage right now, and it's making a big difference in terms of the experiences. However, businesses should also recognize that even if we do start to rebuild activity, the sheer scale of economic hit, what economists call the loss of demand in the economy, has been on a scale that means that even if a vaccine was to be found tomorrow, we're unlikely to see a sudden return to how things were back in January or February. We're seeing some very interesting signs that consumers are saving a lot more money than before. That mood of caution, that shift in attitudes, that loss of confidence, if you like, reflects both a real economic shock, but also a general sense of fear, which won't disappear quickly. And that's going to affect consumer spending and overall economic activity for some time. So I increasingly think that perhaps the best model for trying to work out what's going to happen is not so much the V, which I think is hopelessly over-optimistic. It may not even be the U, because I think even that's too over-optimistic, this idea that you go up again suddenly at the other side. It could be a W. I think an L is probably a bit too pessimistic. So I am increasingly looking to a square root sign or a Nike swoosh, where you go down, you then go up a bit, and then you flatline for a while. That may not be what you want to hear. It's not necessarily what the stock market is pricing in. The stock market is a lot more over-optimistic than I think merits the reality on the ground economically. But I think the stock market is being driven a lot by the super loose monetary policy. And so I think that all things being equal, we should be looking to a Nike or square root sign for where we're heading.
Thank you so much, Gillian. Just a follow-up question on the consumer behavior and the less spending and the fear. Do you think that, have you seen companies in other parts of the world or in America incentivizing consumers to spend and actually just like make that bridge?
Well, there's certainly a lot of ideas happening, not just so much in America, but also over in Europe, where the Europeans have an even bigger problem in some ways, because there's a lot of savings sitting on the sidelines that they want to mobilize at some point. I mean, New Zealand, to take one example, has been talking about creating a 4-day working week to persuade New Zealanders to go off and travel internally during the 3-day long weekends to boost the tourism industry. I suspect that you're going to see a lot of sales, a lot of discounts, a lot of efforts to try and entice consumers back all over the world in the coming weeks. But it's not going to be easy. And I think the only way, if you're a small business, to deal with this loss of confidence, this eruption of fear, both about the generalized economic outlook, but also about the very real question of, can I actually go into a shop, go into a restaurant safely, is to recognize it, don't run away from it, and do everything you can to be flexible, adaptable, and nimble, and both show consumers that you're taking PPE, testing and hygiene measures seriously, and then rethink what you're offering. Can you do takeout? Can you do sidewalk food? Can you do sidewalk sales? I mean, there's plenty of innovation and adaptation going on. And the one thing we've learned in recent weeks is that consumers and people are a lot more adaptable than we often think. I mean, who in their wildest imagination would have imagined just 2 months ago that suddenly everybody on the streets of New York would be wearing masks? I say that because I used to work in Japan, and in Japan, masks were very common. But when I came to New York a few years ago, they were completely unknown. And if you wore a mask, it was a sign of stigma. It was a sign that something was wrong with you. In just a few short weeks, we've now turned that on its head, and now it's a stigma to not wear a mask. So people can change and adapt more than you think. And I suspect that businesses that are going to survive and thrive will be the ones that find a way to tap into that changing consumer behavior.
Yeah, and we have seen, thank you so much, Gillian, Tett, and we kicked off the month of action for Hispanics and incentivizing individuals and corporations to take action in favor of those Hispanics that have been affected. And we had 5 giant companies joining and setting the example for other companies trying to target, trying to help the Hispanic community, but also, like bring along their employees to take action and engage the consumers in that sense of we're here with you. So I hope that we can see more. IBM is one of those companies that came along and kicked off the Hispanic Star Month of Action. Christy Tanner. Christy, thank you so much for being with us. You're the Executive Vice President and General Manager of CBS News Digital. Christy, we would love to hear from you. What is the update on the media industry, and what have you heard in this, in this time of pandemic about politics? What's cooking?
Well, I think one thing globally that we're looking at and covering a lot, but which is also hits close to home and is disturbing, are increasing threats to freedoms of the press, particularly in countries that may have been on the edge before. We are seeing them go over the edge. So in the Philippines, the largest broadcast network, ABS-CBN, was ordered to shut down. They are still pursuing renewing their broadcasting license through the courts. And what we are seeing in that country is that the government is using the same types of legal threats to that organization that they had previously used against Maria Ressa, who is somebody who's well known for calling out the government through her reporting, and also some of the threats of social media. And they have tied her up in the courts for several years now with multiple lawsuits alleging everything from tax evasion to other violations. And what this does is curb the press freedoms in that country. Similarly, in Hong Kong, as made a lot of headlines over the weekend, if you were paying attention, the government on Friday announced that it was planning to impose new national security laws that would ban treason, secession, and subversion. And so, again, Hong Kong's been a country that on the edge, but where press has been allowed to operate somewhat freely. There is now great concern there that in addition to other threats to the citizen, that the press will be threatened as well there. So we are seeing some governments take advantage of the instability caused by the virus to threaten the press around the world. In terms of the business of news in the U.S., while we have what I would say is more or less typical back and forth with the government, we are seeing, as we have for other issues, misinformation and disinformation being spread on social media. That remains something that we are combating as a trusted news source. Other interesting trends in the business of news are advertising. We have seen some advertisers reluctant to advertise around what they see as the negativity of the virus coverage. I have to say that at CBS News, we've seen some of that. We have not been as impacted as some other news organizations. And in fact, we have seen some advertisers test the waters during the virus, been pleased with the results, and have come back for bigger ad buys. Just anecdotally interesting on our part. And then the third trend in the business of news is local news. There's really been a surge in trust in local news sources. Again, at CBS News, we happen to have 10 local news streams that are free and live, and those streams have all surged in terms of their viewership during the virus. People are tuning in the middle of the day to see their governors and their mayors speak live about the latest updates. When it comes to politics, our latest polls have shown, and we touch on this a little bit, that partisanship is increasing during the virus. We are seeing things be politicized that 3 months ago you might not have seen be politicized. Just the concept of wearing a mask has become a political statement. You saw over the weekend the president not wearing a mask while playing golf and criticizing Joe Biden for wearing a mask. Mail-in voting, again, something that a few years ago seemed like an innocuous, nice to have, not a huge deal, has now become politicized. The concept is now being hotly debated, and it's falling along political lines. What we have seen in our latest CBS News poll is that really partisanship is what defines your reality. What party you're in defines which communities are affected the most in terms of how you see it. We've asked people, do you think coronavirus will have a lot of impact on Black communities, Hispanic communities, and white communities? The results of that, generally speaking, were that 60% of those we polled thought it would have a lot of impact on Black communities. 57% thought it would have a lot of impact on Hispanic communities, and 32% said it would have a lot of impact on white communities. So you can really see there the big swing in people's point of view on how the virus would impact different communities.
Wow, how interesting. And I cannot wait actually for Jesus Mantas, the managing partner of IBM, to give us a response from the business perspective. But Christy, before you go, I would like to have your say about advertisement. I actually had a feeling that advertisement was going down dramatically, and that brands and companies were not really spending money in anything that was not related to COVID. So either they were pivoting their products so that they cannot sell but solve during this time of a crisis. And how do you see that, particularly for us, is dramatic, because we got data from Nielsen saying that 117 brands that changed their communications towards COVID, that were active, and only 13 of those were targeting the Hispanic community, which for us is really dramatic, because the result is that 44% of the Hispanic community is in denial of COVID and therefore are not rightly protected, and therefore a number of things. So just say a little bit more about that.
Sure thing. So, I mean, when the lockdown began mid-March, our advertising sales team immediately started calling all of their biggest clients to say, what are your plans? What are you doing? And CBS News has the great benefit as a media company of being part of a huge conglomerate of Viacom and CBS. So we have a lot of air cover as a news organization when it comes to talking to and our relationships with the biggest advertising clients. We have not seen the level of impact to advertising in CBS News, whether that's broadcast or digital, that other news organizations have seen. Those news organizations that are largely dependent on display advertising on websites have seen a massive impact due to what we would call negative keyword targeting. So in the programmatic ad space, advertisers would say, I don't want my ads to run next to any stories that contain the word coronavirus, virus, etc. Having video advertising helps us there. Similarly, the relationships and that air cover of a big company help. And I would say also being a trusted news source helps us as well. That said, some companies have pulled their campaigns and have said they will not be back until there's a big change. Others have said they want to be a part of our coverage when it's more focused on economic recovery than on the impacts of the virus. We have seen, having said that, I would say 3 trends among those who have chosen to continue advertising. One is a pivot to creative that addresses the virus. So car companies that change their creative to focus on the fact that you could have a car delivered to your home if you purchased one. Anything that I would put in the sort of direct response. So certain fast food chains have increased their advertising and found it to be successful. And the third, it has been, well, I'll just say there are more examples, but Charmin in particular has changed its creative to tell people not to worry about a shortage of toilet paper. So I think that there's a range of responses, and from my perspective, we've done tons of studies in the news industry in general and at CBS News that show that advertising around news, even if that news is perceived as negative, whether it's politics or the virus, does not impact viewers' perception of the advertiser's brand.
Right.
And every single news organization has studied this. Some of our third-party trade groups have studied it. The 4As just came out with a study confirming this as well. And so what we have seen is a movement on the part of news organizations to encourage advertising and to really get out there and address this head on, so that advertisers will realize now it's really the time, as you said, Claudia, to support trusted news, so that it can be sustained, but also so that the viewers who have surged in their viewership of news are receiving the right information from your brand.
Well, count on us. We will continue actually making a push for corporations to go and do media spend, particularly addressing the issues that concern our community. Christy Tanner, thank you so much. I cannot wait for you to hear the response of Jesus Mantas, again, managing partner of IBM. IBM has a huge number of clients in corporate America, and every week brings us a perspective about best practices, but also Jesus Mantas, you mentioned last week the increase of cybersecurity as an issue. And since you mentioned that, I've seen an incredible amount of increase in that as an issue overall. Jesus Mantas, thank you so much for your weekly update.
Of course, Claudia, always a pleasure to be here with Christy, Gillian, David Nabarro, and the rest of the team. What I thought I would talk today, almost following the lead of Gillian, is returning to workplace. So what does a big company, when you operate in over 100 countries, how do you manage? How do you set policy to reopen safely in the edge of doing that? So one of the things we've done is we've created our criteria for 3 waves. Wave 1 being just the immediate release of the stay-at-home orders by the government, which from our perspective is a necessary but not sufficient condition, right? So we we won't automatically reopen or allow people to return back to work just because the stay-at-home order is released. It has to be supported by local clinical and population health data as well. So, in the case that, a stay-at-home order would be released, but the data would indicate that it's not safe to return to work, we would not reopen any of those facilities. The unrestricted availability of PPE that Gillian mentioned, so especially masks and sanitizers. And then remember, a lot of our employees, like any other big companies, they actually have to get to work. So we want to make sure that they have a mechanism to safely get to work, and that is availability of safe public transportation. So once our employees meet those conditions and that facility reopens, we're providing every one of our employees 2 masks daily, right? So if they have to come, we will actually provide them 2 masks daily. We're reconfiguring the space on all of our facilities. So the desk, the seating, the floor markers, any approach, eliminating congestion and keeping some of the common areas closed as a mechanism to aid the social distancing guidelines. Some of the, obviously cleaning services massively enhanced, increased air ventilation. So modify the air conditioning to promote additional ventilation. And then all of our food services are actually modified as well, just again, to prevent one of the common hubs for the spread of the virus. We do site readiness audits. We actually enforce protocols for management of suspected cases. And then just make sure that we do massive amount of communication, right? So you cannot over communicate both on our facilities as well as our clients' facilities. Just remember, some of this work may actually happen at our clients' facilities. In terms of individual guidelines that we get all of our employees and our clients is, some of them are very obvious, but as we have seen over the weekend on some of the scenes, they're neglected. The first one is, if you don't feel well, don't go to work. It's a very simple one, but we've seen how people are trying to make a trade between the economy and their family and their health. They're not feeling well, but they really go out, and they can result on hundreds of people actually that they give the virus to. So you don't feel well, don't go to work. We've provided a very simple checklist for almost like a daily self-health certification. Like, what are the things that you need to check on yourself to see if you could be suspect, including obviously a temperature check. As they actually come to the workplace, strict adherence to wearing masks and social distancing, and additional communication on personal hygiene practices, right? So all of us have learned how to wash our hands as if we would be surgeons. So keep that to make sure that everybody keeps doing that. And then the last point is, like, who do you choose? Who is really critical to return to our workplace? That's another decision that every one of the companies need to make. And the guidelines are, more qualitative than quantitative. Obviously, we have an element of capacity, but one of them is really, we're pushing hard. Can you really achieve the outcome if you stay working from home? And the fact of the matter is, in technology, a lot of the people can actually do that. And then to bring people back, we just have 2 checks. One is, do we have an expectation of material increase of productivity or material increase on innovation benefit, even when you're going to be wearing a mask and social distancing in the workplace? And that is where a lot of the reimagination of what the work comes in is, there is a lot of things that we're finding out that digital technology is able to, enable. Well, one of the things it cannot enable is to force people to pay attention in the same way that when you're in the same room. So we're really going through, what the work of a person is, and to the extent that they're critical activities that will benefit from ensuring that you're paying attention, those are harder to do via remote digital interfaces. And then bringing everybody in a room, even if it is social distance, can have a great benefit. We're planning on 3 waves. The first wave, which is where we're going to be reopening with very limited ability. We expect the majority of our employees will still work from home. It's really down to some essential employees. the second wave, before we would trigger the second wave, we would have to see a significant improvement on testing and contact tracing capability that most of the states and governments don't really have. We are working with many of them to provide a technology, if you want, complement to the human element of contact tracing, but the majority of contact tracing in the majority of the countries will still be a human activity, something that it takes an enormous amount of resources. So the availability of that will be an important trigger for us to get to wave 2. And our ultimate, which is wave 3, where most IBMers will return to workplace, we would have to see a significant quantum leap again on the ability of contact tracing, as well as the data that dramatically reduces the likelihood of a positive in the workplace. So those are some of the tips that we're working, and we basically evolve them every week as we learn more about the virus.
Thank you, Jesus Mantas. I know that you're part of, if you're not leading the COVID initiative within IBM, and I hope that Christy Tanner, for example, gets. I saw, like you're like winkling and saying like, yep, maybe bring Jesus Mantas and other people to the show, so that you can inspire other people to bring, like a roundtable of like innovation and how can companies start sharing best practices on reopening, which it will be a big deal. And Jesus, I cannot tell you how expensive it sounds, everything that you're doing, and I have no clue how small businesses could do any of the protocols or half of the protocols of safety for your employees could do. And for that, I thank you so much for being with us. And for that, I would like to bring Cristina Antelo. She's the principal of Ferox Strategies, and every week brings the policy angle. Ferox strategy from Washington. What's the administration thinking? And I would love, Cristina, to give us an update and also react to a couple of the things that you have heard, particularly Christy Tanner talking about partnership, partisanship, and whether whether you're seeing that in Washington as well, or whether you see like any difference. So, Cristina Antelo, welcome.
Hi, thank you. One of the things I want to get to today is on the same kind of trajectory that other folks are talking about, and that's getting back to work. And I think Congress is finally getting back to work. They figured out a way, instead of just kind of showing up every once in a while and voting on one giant package, kind of getting back to the regular order and several packages that are part of our work every year. But first on the PPP, the House is set to hold votes this week, and they have some fixes that they are recommending for the program. What's interesting about this bill is that it is finally bipartisan. It's not just the House Democratic stamp of approval and kind of their wish list. There are several changes. I think the most relevant that I would bring forth to your viewers, for small businesses in particular, is that for the loans to be forgiven, they have Treasury and SBA had instituted an additional rule that was not written in legislation, that 75% of the money used had to be used on your payroll, and only 25% could be used on other business expenses, for example, for your rent and your mortgages and your supply chain. This bill would do away with that there would not be that requirement for the 75% on payroll, which is a big deal for a lot of folks who own, for example, a restaurant. You may not be spending a lot of your money right now on your payroll, but instead you want to be able to keep your restaurant open, so you've got to pay the rent. And so that's out there. The Senate is scheduled, they also have a proposed fix for the PPP. They do not have a fix for the 75-25 rule, but both of the programs extend the benefits for the PPP program. Treasury has also come out with some additional rules over the weekend to help aid and kind of correct the program, also not fixing the 75-25 rule. So I think that is a point of contention that we should be watching for. That's a lot of small businesses probably have a stake in, and if you do, and if you happen to live in a state that is Republican, I would urge you to reach out to your members of Congress, because they need to hear from you more than others. But getting back to Congress working now that they have figured out how to do proxy voting, so that vulnerable members need not fly to Washington to be able to have their votes count. There are several things on the to-do list. One of them is the Fisa Reauthorization. The Senate took that up, and now we expect the House to take that up. The NDAA, the National Defense Authorization Act, is where the United States collectively comes together with their policy on defense. And that is a gigantic spending tool for the Congress. So having them bringing that up, coming up, it's supposed to be, they're already at least 5 weeks behind, but now we're hearing that it might get pushed to the end of June. So even a little bit more behind, but nonetheless, they're taking it up. There are some other public land packages that are coming up that have been up in the Senate and kind of reviewed there. The Senate's also going to continue to work on nominations, but also appropriations. Appropriations is the process by which the Congress funds our government. And all of that comes to a close usually September 30th. There's usually a continuing resolution, and then they try to figure it all out. And then there's a big budget deal usually towards the end of the year, and everybody's all holding their breath, but eventually gets done. That work has fallen significantly behind, but the House is still aspiring to get it done this summer so that they're able to negotiate with the Senate. They had hoped to have it wrapped up by the end of June. I think that was obviously very optimistic, but now they're still on pace to go through July to keep working on that. You know, another change I would watch out for is, you know, typically Congress takes these recesses, these times where they get to go back to the district and work, because they have been more in their districts working from there, trying to conduct their business from their home states. You can see things like the recesses being given back, meaning that they won't take them. In particular, the August recess is 3 to 4 weeks typically. I don't see that happening. Also, during an election year, October they take off for campaigning. So I think that will change. You know, one more thing that I would point out, just for this audience in case there's interest there, is that the White House continues to make some changes without any supervision or oversight on immigration policy, and making that more and more strict and stringent on folks being able to try to get in on the regular visas, work visas that they had historically been able to get in under. Also now, in response to Brazil, they're locking down travel to Brazil. I think generally speaking, though, I would report to you that Congress is finding a way to move forward. They're doing more and more work remotely, and they're able to get through it. So if you thought Congress wasn't going to be making policy moves on any of the things that your businesses are watching or that will be impacted by, I think again, because they are finding ways to get through that and even conducting hearings online.
Thank you so much, Cristina. It's great, actually, this update. I do have a question regarding, I mean, like we've seen and you've been reporting that government will continue injecting funding, and we have Leroy Cavazos from the Hispanic Chamber of Commerce coming after, but one is like, that's good news. They are injecting even more money. But the second one is there, I mean, like I've heard so much today about reopening and testing, how important it is, and consumer, and how important it will be for the consumer to feel safe in that space. Is there anything that we could do as the Hispanic leadership to try to make a deal so that we can be favorable, you know, like that we can have testing, you know, like as Hispanics are so much into service, like 17 million of us, 19 million of us work in essential functions and 17 million in, you know, like in services. Is there anything that we could ask for a favorable or a priority testing?
Yeah, you know, I think for those types of businesses that are deemed essential and yet are completely commercial. So for example, meat packing, right? I mean, we have seen it go from 700 workers falling ill to 16,000 that work in meat plants. And there hasn't been a lot of change from their policies. So to your point, and you know, who are the people who work in meat packing processing plants? They're usually Black and brown folks, and that is the part that seems, you know, the economic disparity becomes even more, and the racial disparity becomes even more relevant. So to your point, I mean, if we are going to say that, you know, keeping our food supplies and our supply chains open are critical, which they should be and they absolutely are, then we need to make sure that those workers are protected even more so. And if they're going to be, you know, even sanitation workers and things like that, they're picking up, you know, potentially biohazardous waste from hospitals and things like that, or other locations. We do need to make sure that they are protected with PPE and testing. I don't know that there's been, there's more and more light being put on the situation because of the sheer numbers kind of requiring it. I don't know that there's a solution yet. And I do think that we need to keep the pressure on our policymakers to make sure that they take that into account, that if those businesses are going to open up and Republicans want to give them liability protections so that workers can't sue them, there has to be then, okay, fine, we'll give you a liability protection over here, but only if you do these things. And on that list of those things, that has to include those protections for those kinds of workers.
Thank you, Cristina. I would love to work with you so that next week or next Tuesday we can come up with a proposal so that we can all Hispanic leaders can support something where we're, you know, like trying to see how we can help our Hispanic community come back faster, tested, and so that we can incentivize consumers to go back to those places by having a proposal. So thank you so much, Cristina and Antelo. Looking forward to working with you throughout the week to see what we can propose together next Tuesday. And to close, thank you. First of all, thank you so much for all the speakers for being here week after week, and for Christy Tanner for coming this week. Leroy Cavazos to close, always from the Hispanic Chamber of Commerce, bringing us a perspective about like what's news for small businesses.
Thank you so much, Claudia. And on behalf of the United States Hispanic Chamber of Commerce and our chairwoman of the board, Carmen Castillo, our president and CEO, Ramiro Cavazos, for the work that you're doing out in the Latino community to make sure that Latinos businesses in this country have a fair share of the economic pie. We are hard at work still at the Hispanic Chamber conducting advocacy on the Hill, and we have done a lot of webinars in the past couple of weeks and technical assistance resources for grants with companies like Facebook, Google, to make sure that Hispanic businesses are getting the resources that they need to either bring their businesses online, to get necessary capital into their hands, or to guide them through the process of applying for PPE loans or EIDL loans. It is critical that we continue to work with America's financial institutions to make sure that now that Congress has allocated this funding to the banks, that we start following the dollars, that we maintain equity in those dollars, and that we hold accountability for those dollars. We know that a lot of that money has made it out into the market, so we need to continue to be vigilant in making sure that Latinos are getting their fair share. We're going to be hosting a webinar next week with Bank of America and Merrill Lynch in order so that Latino businesses have access to that platform of how those PPE loans and EIDL loans are going. We encourage people to continue to apply for the EIDL loans. We know that there's going to be more stimulus coming in a next package. As Cristina always puts very eloquently, we finally have bipartisan support for the next stimulus bill, and so expect more funding. So for those businesses, another very important thing that I like to drive home is do not lose hope. There's help out there, and we are doing our best to get you the help that you need so that your operation can continue and so that your business can begin to thrive again. On the piece of opening up safely, Claudia, is that we are working with local chambers on our network of over 250 chambers across the country to make sure that best practices are shared to local business communities to open up. And we're also working with CDFIs and minority depository institutions that as businesses go and apply for loans at these financial centers, that they are given tips and technical assistance resources on how to reopen their businesses in a safe way to maintain social distancing, but also to economically come back. So we will continue to fight for the more than 4.8 million Hispanic-owned businesses in this country who combined contribute $800 billion to the U.S. economy, because we understand firsthand that that is what is going to ensure the future vibrancy of the American economy. And we're happy to stand in solidarity and in unity with you, Claudia, and the work that you're doing and the rest of the folks on this call.
Thank you so very much. I am very glad that this week, for the first time in 7 weeks, we're talking about reopening, and we are ready to take a recovery plan so that we can be ahead of our time and get back in our feet as soon as we can, and stronger, get out of this one stronger than before. Thank you so much, everybody. Thank you so much, Dr. David Nabarro, Gillian, Tett, Christy Tanner, Jesus Mantas, Cristina, Antelo, and Leroy Cavazos for being here with us. Thank you so much. See you next Tuesday.